Hello guys, a very good evening to all of you, and I welcome all of you to today's session of Autonomic Nervous System. तो आज हम ANS के कुछ क्वेश्चंस डिस्कस करेंगे और you might have seen in last 1 week I've started posting every day 5 to 6 questions on the topics on Instagram and Facebook as well. So first of all, tell me guys, how are you all holding up? कैसे हो आप सब? Good evening, नेहा सिद्दीकी, जगमीत कौर, एटम, good name, Sabaz. So good evening to all of you. कैसे हो सब? सब मजे में? How are you all guys holding up? All right, good, great. Good evening guys. Good evening to all of you. Good evening. Now tell me something guys. See, I told you the reason why we are doing this exercise of revising one topic in a week, right? And not revising, the whole pharma in 8 to 10 days. Rather, we have segregated it. So the main reason, which I have told you already, is that let us go to today's session. So main reason I've told you how to go about this is if some people they have joined for the first time, then you can see this is the schedule for third week. Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Sunday is the live session. So you're gonna study from Monday to Saturday. Monday से लेकर Saturday तक हम पढ़ेंगे. And I've given you only that much that would require 1 to 2 hours only. Someone might require 1 hour, someone might require 1.5, someone might require 2 hours. Approx 1 to 2 hours. So Monday you will study a topic for 1 to 2 hours. Tuesday you will revise it for 15 minutes, 15 to 20 minutes, right? And Wednesday you'll revise the same topic for 5 minutes, re-revise. Now tell me first of all, are you doing this or not? देखो, अगर ये आप नहीं करोगे ना, अगर ये आप नहीं करोगे, तो ये जितना भी मैं आपके लिए कर रहा हूँ, ये सब बेकार है. Everything is waste if you're not doing this. So guys, tell me honestly, are you doing this or not? Because this is the main reason, because why I'm doing this is so that you study for 1 to 2 hours every day. Then second day revise for 15 minutes, third day re-revise for 5 minutes. Now see, you have to do this. If you're not doing this, then don't follow the timetable. It is worthless. Don't waste your time. Because the only if you'll get the benefit only if you do this. आपको फायदा तभी होगा अगर आप इसको फॉलो करेंगे. अगर आप इसको फॉलो नहीं करेंगे तो फिर कोई फायदा नहीं है, राइट? सो यू हैव टू डू दिस. देखो यार, दिन में मुझे बात बताओ, 15 और 5 कितना होता है? 20 मिनट होता है. 20 मिनट नहीं है क्या? डोंट यू हैव 20 मिनट्स? जस्ट 20 मिनट्स, राइट? कैन यू टेक आउट जस्ट 20 मिनट्स एवरी डे? सो यू हैव टू डू दिस. सो एनीवेज, इफ यू आर स्टार्टिंग फ्रॉम this week or next week, does not matter. The only reason I'm doing this, the only reason I do this is because you'll get benefited only by this particular thing, right? Anyways, and I've told you time and again that the live session is not the most important thing. The most important thing is this. तो live session इतना important नहीं है जितना important Monday से लेकर Saturday है. Monday से लेकर Saturday तक ये जो exercise आप करेंगे, that is the most important part. Right? And I've told you again in my lectures, in online lectures, in my offline lectures, wherever I take offline lectures, I tell you always to write down the drug of choice separately. right? Drug of choice separately. So why do I tell you to write down the drug of choice separately? Is so that every day before going to bed at night, you can revise at least 5 drug of choice, right? So when you go to the revision days, when your revision days will start, if your DOC is written separately, every day just before going to bed, you can revise the drug of choice. So antidote of choice and drug of choice, you should write down separately. You might get a Xerox from somewhere, PDF from somewhere, but it won't be that effective, right? If you make it yourself, the list yourself, that is more effective. All right. See, if it is taking more than 15 minutes, if it is taking more than 15 minutes, इसका मतलब क्या है समझो? What is the meaning of this? इसका मतलब यह है कि आपने मंडे को अच्छे से नहीं पढ़ा. If it is taking more than 15 minutes on Tuesday, that means Monday you have not studied well. That is the reason why. See, this mechanism, it also tells us, have I studied it well or not? So if I'm not able to revise it in 15 minutes, भाई 1 से 2 घंटे के अंदर जो पढ़ा है 15 मिनट में अगर मैं रिवाइज नहीं कर पा रहा, मतलब मैंने अच्छे से नहीं पढ़ा है. Let's be honest with it, right? So it is actually, you can make a diagnosis. Anyways, see, pharma is volatile. I know that. भाई ये कर क्यों रहे हैं? Why are we doing this? The only reason because pharma is volatile, right? So pharma, microbiochemistry, pharma is volatile. Okay, what if I tell you there is a way by which every drug of choice can be on your tips? What you can do is write down the drug of choice separately every day before going to sleep, before सोने से पहले रात को 5 मिनट के लिए तकिया के नीचे कॉपी को रख देना. Every day at night before going to sleep, can you just scan 5 drug of choice, keep it in the bed and go to sleep. Next day you can read another 5 drug of choice and just actively recall by placing your hand, do you remember whatever you have studied yesterday or not? So see, that is, and see, every subject cannot be perfect. You cannot be perfect in every subject. What you have to achieve is to become near perfect. Anyway, so guys, my aim is to make you understand the purpose of this exercise. I just sincerely want that everyone gets the point, why am I doing this, right? All right guys, let's start with today's question. Which of the following is pre-synaptic receptor on SA node in parasympathetic nervous system? This question I had posted in Instagram as well. Come on guys, come on. देखो, जिसको आंसर पता है नहीं पता है, आंसर करना है. Everyone has to answer. You know the answer, you don't know the answer, does not matter. See, I'm not going to give any rank here, isn't it? So just think, try to analyze, whatever you feel is the right answer. Comment. Come on. All right. तो आज पहली जाल में ही सारी मछलियां फंस गई. पहली जाल में सारी मछलियां फंस गई. See, all of you are caught in the honey trap. Yeah, the answer is not M2, guys. The answer is not M2. The answer is M1. The answer is M1. Answer is not M2. All right. Why it is M1? Because you missed something. You missed the word pre-synaptic in the question. You missed the word pre-synaptic in the question, right? If it would have been post-synaptic, then your answer would have been M2. If it would have been post-synaptic, then your answer would have been M2. So let us say this is my neuron, right, from parasympathetic. This is my parasympathetic neuron. And let us say this is let us say one of my SA nodal cell. This is one of my SA nodal cell. So usually what happens is, normally, see, on the SA nodal cell, we have M2 receptor. which is GI subtype. M2 receptor is GI subtype. And acetylcholine, whenever acetylcholine is released, it stimulates M2 receptor. It is inhibitory. That is the reason why there is a block of acid node and there is a decrease in heart rate. Now, here comes the concept of autoreceptor. You know that pre-synaptic, we have pre-synaptic autoreceptor. So there is a pre-synaptic autoreceptor, right? Pre-synaptic. And in this question, I've asked you, which is the pre-synaptic receptor? I have not asked regarding post-synaptic. Post-synaptic is M2. Now, you know that autoreceptors, they are usually GI subtype. Why God has made autoreceptors inhibitory subtypes of autoreceptors on pre-synaptic membrane? So that whenever they are stimulated, they will block the release of acetylcholine. So the aim is automatic control of release of neurotransmitter. Now try to understand, because the post-synaptic receptor is M2, that is in the heart, and it is GI subtype, M2 cannot be the pre-synaptic autoreceptor. So autoreceptor everywhere, it is M2. If I ask, in the brain, in the bronchi, or in the lungs, in the stomach, in the bladder, everywhere it is M2. But the only organ where it is M1 is heart. So M1 here, this receptor is M1. It cannot be M2 because M2 is also what? Post-synaptic, right? So guys, you understand here, so the reason here, the answer is M1. The answer is M1. And the question that I've asked here, it has some relevance. I've not asked it just like this. This question will have relevance. This M1 receptor will have relevance in some other question, which I will come. So guys, did you understand this? Give me a thumbs up if you understand this. समझ में आया सबको? आप लोगों को समझ में आया? What is the meaning? So if they ask you post-synaptic, excellent guys. See, this session is helpful for any exam. It is for FMG, NEETPG, whatever exam you're targeting, it will be helpful. The reason being, even your FMG exam, the questions are of good standard. They are as good as the NEETPG questions. The reason being, in the coming times, there will be next exam. So they are standardizing the paper of FMG and NEETPG. The questions, what I have seen, they are good questions in FMG, and they are not repeat questions. The topics are repeated, but the questions are new. All right, guys. Organophosphate poisoning. Prakash Pat is asking, is it M1 for tachycardia? See, organophosphate poisoning, they can cause tachycardia by M1 receptor. Ramani Gorla, thank you. Nicotinic receptor subunit configuration: 1 alpha, 2 delta, 1 beta, 2 alpha, 1 delta, 1 kappa, 1 alpha, 2 delta, 1 epsilon, 2 alpha, 1 beta, 1 gamma. Alright, so this is not a difficult one. Excellent, guys. Excellent. All of you. Most of you are giving the correct answer here. So I told you how to remember. So I've told you the nicotinic receptor in the lectures. It looks like a flower. It has 5 subunits. And out of these 5 subunits, 2 subunits are always alpha. So alpha has to be 2. That means A and C is gone. Alpha has to be 2. In fact, if they ask you nicotinic receptor, which is the most important subunit, your answer would be alpha, right? One can be beta, one can be gamma, another can be either delta or epsilon. So see, there is no kappa. So there is no kappa. So B is gone. So you're remaining with D as the answer. And I'm proud of all of you. Most of you have given the right answer here. The right answer है वो D है, 2 alpha, 1 beta, 1 gamma, nicotinic receptor. So see, this is an MCQ which can be asked in your exam. How does it look like? So most of you have given the answer, right? Aminoglycosides can increase the effect of. So see, the question I had asked about aminoglycoside, it was different. It was different, but here I have given it a little spin off from what I had asked you in Instagram. इंस्टा में जो क्वेश्चन पूछा था मैंने आपको, उसका थोड़ा सा चेंज कर दिया मैंने, राइट? Aminoglycosides can increase the effect of neostigmine, acetylcholine, calcium, succinylcholine. Come on guys, what is the answer? देखो ये क्वेश्चन डिफिकल्ट नहीं है, ये क्वेश्चन डिफिकल्ट नहीं है. This question is not difficult. The only thing you should be rich in analysis. You should be rich in your analysis. तो देखो ये जो synapse आपके दिमाग में बनना चाहिए, it should be made automatically in your brain, and you know that acetylcholine is released into the synapse that will act upon muscarinic or nicotinic receptors. There is a pre-synaptic calcium channels. There is a pre-synaptic calcium channel. This is blocked by aminoglycosides, and aminoglycosides, they block release of acetylcholine. Aminoglycosides, it blocks the release of acetylcholine, right? And acetylcholine, it is metabolized by ACHE. ACHE is blocked by neostigmine. So can A be the answer? Can A be the answer? Aminoglycosides, they block release of acetylcholine. Will they increase the effect of neostigmine? No. Aminoglycosides block the release of acetylcholine. Will they increase the effect of acetylcholine? No. Aminoglycosides can increase the effect of. देखो गलती ये होती है, you do this mistake because you've heard about aminoglycosides somewhere in relation to calcium. You will jump onto calcium as the answer. Calcium is not the answer. Calcium is used for treatment of neuromuscular toxicity. Calcium को यूज किया जाता है neuromuscular toxicity that is caused by aminoglycosides. So how aminoglycosides will increase the effect of calcium? It is absurd. It is absurd. It has nothing to do. भाई तो ऐसा मत करना, सोचा करो, दिमाग लगाया करो ना, दिमाग लगाया करो. Succinylcholine क्या है? What is succinylcholine? It is a muscle relaxant. Succinylcholine is a muscle relaxant. So succinylcholine is a muscle relaxant, or it will decrease. Succinylcholine will decrease muscle contraction. And acetylcholine, aminoglycoside will also decrease acetylcholine, that will also decrease muscle contraction. And that is the reason why your answer would be D. Aminoglycosides, they can increase the effect of succinylcholine. Right? So did you understand this, guys? If you understood, give me a thumbs up. Have you understood this? It's not a difficult question. It's an easy one. The only thing is, see, you will be able to solve such kind of questions only if you understand the topic. If you just mug up the topics by mnemonics and tricks, you'll not be able to solve such questions. Because see, nowadays the questions are more application based. Direct questions everyone is gonna solve. हर कोई direct question solve कर लेगा. Rankers, what divides rankers from non-rankers is if you are able to solve the application based questions. Knowledge whichever you have gained. Methacholine is used due to its action on. ये Instagram पे पूछा था मैंने last week where I posted this question as well. Methacholine is used due to its action on. What's the answer, guys? M1, M2, M3, M4. I'll give you some time. so that you can comment. Do comment. Do comment the answer. If it's wrong or if it's right, does not matter. Today here we are not to judge anybody, right? Our aim is to at least attempt. And once you attempt, I'll tell you where you go wrong. Myocardium, and in myocardium we have M2 receptor. So what you have done? You have purely mugged up. You have purely mugged up and you'll go for M2. You look at methacholine, you will jump onto M2 receptor. That's not the way. I have not asked where methacholine acts. Methacholine is used due to its action on. What is the action of methacholine? See, action, I use it because of its action on bronchi, bronchial challenge test. And on bronchi, the receptor that is present is M3. M3. So see, here the right answer is not M2, it is M3. So there are two things. If they ask you methacholine, if they ask you methacholine acts on, then M2. If they ask you methacholine is used due to action, then your answer would be M3. Right? So get this simple thing in your brain right. And I've told you time and again, don't just jump onto the answers right away. आप मीथाकोलिन देखते हो, M2 देखते हो, बोलते हो और क्या चाहिए, मीथाकोलिन है, M2 है, जिंदगी में और क्या चाहिए, इसी को मार्क करो. ऐसा नहीं होता. Don't do like that. Read the question carefully. Try to find the answer. Try to find the answer. Because जो एग्जामिनर है उसको भी पता है कि how much you get excited by looking at the questions, and when you know that this is the answer. So that is where half engineer, see, I cannot, मैं मैरो में हिंदी यूज नहीं कर सकता because मैरो there is no हिंदी, you know, हिंदी मीडियम है नहीं, हिंदी मीडियम मैरो में नहीं है, तो उसके लिए मुझे फिर अपना अलग से मैरो खोलना पड़ेगा. So there is no provision of Hindi language in Mero, guys. I wish there was, because see, if you ask me in which language I can teach better is Hindi, obviously, because every person can speak in the language with which he is more well versed with, because we talk with English language from here, but if I talk in Hindi, I talk from here. So same is the thing with either a Telugu person or Tamil person, they speak the language from here. That is what happens, right? So anyways, guys, so let's move on. So I hope this is clear, guys. Is this clear to all of you? A patient of Alzheimer's disease develops urge incontinence. All of the following are good choices except. All right. A patient of Alzheimer's disease, Pooja Chauhan, thank you very much. A patient of Alzheimer's disease develops urge incontinence. All of the following are good choices except trospium, darifenacin, flavoxate, mirabegron. Saida Rahman, if you're not following my previous weekly timetable, then follow it from now on and then extend it for the next 2 weeks. I mean, after we are done with this, G Pharma ANS, you can do at last. But now follow with the rhythm so that you are not held back, right? Sunita Nakka, Pharmcast, I'll make Pharmcast, but you see, I'm one human and I'm burdened with so many things, right? And teaching you guys is much easier. I have to teach my daughter as well, who is in class 2 now. And apparently it seems class 2 syllabus is much more difficult for me to teach. मतलब जो छोटे बच्चे हैं ना, उनको पढ़ाना, मतलब 1 महीना पढ़ाता हूँ तो मेरा हीमोग्लोबिन 1 ग्राम कम हो जाता है. It's so difficult to teach young children. तो उसको भी पढ़ाना पड़ता है भाई. So I'll try to record, right? Trospium, darifenacin, flavoxate, mirabegron. So guys, what is the answer here? So Alzheimer's disease patient and develops urge incontinence. All of the following are good choices except. Again guys, this is an MCQ with little bit of twist. थोड़ा सा दिमाग डालोगे तो आंसर मिल जाएगा. Why you are answering trospium? I don't understand. There is, can't you see the except? Can't you see the except? See, urge incontinence, I can use drugs which are non-selective. They'll block M1, M2, M3. And I have selective M3 blockers like darifenacin, solifenacin, tolterodine. All others are here like flavoxide. Now see, usually in brain, the one that is responsible for cognition is M1 receptor. M1 is responsible for cognition. That is why in Alzheimer's, I'll try not to use a non-selective one, but there is one exception, trospium. In non-selective class, it can be used because it does not cross the blood-brain barrier. So if they ask you here, if I would have asked you which is the best drug, your answer would have been trospium. Your answer would have been trospium. But I've asked you all of the following are good choices except. Can I use trospium? Yes. Can I use darifenacin? Yes, I can use darifenacin because it is an M3 blocker. Can I use flavoxide? No, because it blocks M1 as well. Can I use mirabegron? Yes, because it is a beta-3 agonist. It has nothing to do with cognition. Mirabegron can be used in urge incontinence, guys. Mirabegron urge incontinence में use होता है. Mirabegron is used in urge incontinence, right? So I've just given a spin-off to the question. A patient on Alzheimer's disease develops urge incontinence. All of the following are good choices except trospium, darifenacin, flavoxide, mirabegron. So what is the answer, guys? Answer is flavoxide. Flavoxide is the answer. Now see, you should be able to analyze and you should be able to solve the questions. Yes, so tell me, is this a difficult question? But ये difficult नहीं है. If you know that, now if you just mug up the answer, अगर आपने सिर्फ answer mug up कर लिया कि Alzheimer's है, this question is in the Q banks, right? मैरो के Q bank में question है ये. Alzheimer's का patient है and he develops urge incontinence. Which drug is used? वहाँ पर answer क्या है? Their answer is trospium. Now, when you go to the exam, just because you've solved an MCQ where the answer is trospium, don't expect that in exam also the MCQ will have answer as trospium. Don't do that, guys. Don't do that. Right? Solve MCQs just to learn how to solve MCQs. But don't apply those answers in MCQs to the questions in the exam. The question might be actually different. The options might be actually different. Right? Mirabegron is not approved for obesity as of now, guys. Mirabegron is not approved for obesity. It might be used in the future. We don't know. Atropine causes tachycardia at doses above 0.2, 0.3, 0.4 and 0.5 milligrams. So what is the answer, guys? Atropine causes tachycardia at doses above. Come on, guys. Come on. Comment. All of you comment. A, B, C, or D. You know the answer. You don't know the answer. Does not matter. Come on. Comment. All of you must comment the answer. Is it 0.2, 0.3, 0.5, 4, or 0.5? Excellent, guys. Most of you are correct. I'm proud of all of you. Most of you are correct. The answer is 0.5 milligrams. The answer is 0.5 milligrams. And if I change the MCQ, atropine causes tachycardia at doses above 0.5 due to block of option A M1, option B M2. What is the answer? What is the answer, guys? देखो ठीक है, 0.5 आंसर है. All of you know this. I understood. All of you know this. It's 0.5, guys. It is not 0.2. It is 0.5, right? Now I'm asking you another cross question. If it is more than 0.5, then tachycardia, it is due to block of M1 or M2. Is it due to block of M1 or is it due to block of M2? Answer is 0.5. I've got that you know that answer is 0.5, and that's excellent. That's excellent. Now what I'm asking is, if it is more than 0.5, that is due to block of which receptor, M1 or M2? Come on, comment, guys. Come on, let me know. Let me know which receptor more than 0.5 atropine will block which receptor to produce tachycardia, M1 or M2? M1 or M2? See, there is a reason. There is a reason why I'm asking this. All right. See, we'll have to go back. Let me come back here to this particular question. Anyway, so I'm not able to erase it. Now see, whenever I give atropine, I can give it less than 0.5 milligrams, or I can give it at doses more than 0.5 milligrams. So remember, at doses less than 0.5, it primarily blocks M1, pre-synaptic receptor. And because of that, if I block M1, which is GI subtype, it would stimulate or increase release of acetylcholine, and that is the reason why there is a decrease in heart rate. So देखो, atropine causes bradycardia at low doses less than 0.5. It is due to block of M1 receptor. More than 0.5 milligrams, atropine blocks M2, and that is the reason why more than 0.5, if I block M2, that would increase the heart rate. Now, some students, they ask me, sir, how is it possible? How does atropine know that I have to block M1 and I have to block M2? ऐसा क्यों होता है? Atropine को पता कैसे चलता है? See, there is something called as threshold concentration. Threshold concentration is the minimal concentration required for block or activation of a receptor. The concentration of atropine required for block of M1 receptor is lesser. M2 receptor is more. So at low concentration, M1 is blocked. At high concentration, M2 is blocked. So all in all, if they ask you, atropine is given, it causes bradycardia at doses less than 0.5 because of which receptor? M1. Atropine is given more than 0.5. It causes tachycardia because of which receptor? M2. So this is called as paradoxical bradycardia, right? So guys, this is the reason why I made this question, so that I can make you understand why this paradoxical effect is seen with atropine, right? So here, as I said earlier, the answer here, more than 0.5, it is due to block of M2 receptor would be the answer. All right. So, Pratik, M1 प्री सिनेप्टिक में होता है, ये कहाँ लिखा है? अरे भाई बुक में लिखा है, मैंने पढ़ा है, मैं तभी तो पढ़ा रहा हूं तुमको, मैं अपने मन से थोड़ी ना बना के बता रहा हूं तुमको। Scopolamine is used in motion sickness as it is. Scopolamine is used in motion sickness as it is H1 blocker, 5-HT blocker, muscarinic blocker, or nicotinic blocker. Scopolamine. So see, scopolamine is used in motion sickness is frequently asked. Is a commonly asked MCQ. Scopolamine is used in motion sickness as it is H1 blocker, 5-HT blocker, muscarinic blocker. Scopolamine is used in motion sickness as it is H1 blocker, 5-HT blocker, muscarinic blocker, nicotinic blocker. देखो ये आसान क्वेश्चन है, ये तो मतलब ऐसा है कि तुमको कोई रात को नींद में उठा के पूछे तो भी आपको आंसर बताना चाहिए. Scopolamine motion sickness. See, this MCQ has been asked a lot of times. What is the drug of choice for motion sickness? प्रतीक 14 नोट्स में नहीं था इसलिए कंफ्यूज था. भाई नोट्स में सब कुछ नहीं दे सकते ना, नोट्स में ऑलरेडी इतना ज़्यादा, और भी मैं बहुत ज़्यादा दे दूँ तो इन सेशंस से, ये सेशंस करने का एक रीज़न ये भी है कि इन सेशंस में मैं आपको कुछ एक्स्ट्रा बता पाऊँ, राइट, समथिंग कुछ अलग से बता पाऊँ. बिकॉज देखो, आप कितनी भी तैयारी कर लो, जब आप एग्ज़ाम में जाओगे ना तो आपको 200 में से 25-30 क्वेश्चन ऐसे लगेंगे कि इस दुनिया से हैं कि मार्स से पूछा है, पता नहीं चलेगा, राइट. सो ये तो आसान है भाई. स्कोपोलामाइन है क्या? व्हाट इज स्कोपोलामाइन? व्हाट इज स्कोपोलामाइन? इट इज अ मास्करिनिक ब्लॉकर. It is a see, you should not see, try to understand this thing. It's not a difficult question by any standards. It's a very easy question. You should not take more than 5 seconds for such questions. 5 seconds, not take more than 5 seconds. The reason being, देखो, easier questions when you solve in less than 5 seconds, you are saving 55 seconds in that question, which are gonna reuse for other questions which are difficult to solve. So excellent guys. Is not by scopolamine कब से H1 blocker हो गया? Scopolamine is not H1 blocker, it is not 5-HT blocker, it is not nicotinic blocker. Scopolamine is a muscarinic blocker, as simple as that. Paradoxical bronchoconstriction due to Ipratropium. It is seen due to block of which receptor? M1, M2, M3, M4. Come on guys. Paradoxical bronchoconstriction पे MCQ पूछा जा चुका है, ionized set. In ionized set, they have asked you one MCQ. I've just made another MCQ related to paradoxical bronchoconstriction. Paradoxical bronchoconstriction due to Ipratropium. It is seen due to M1, M2, M3, M4. Come on guys, come on, quick. What is the answer here? Paradoxical bronchoconstriction, why it is seen with Ipratropium? M1, M2, M3, M4. Costa Botakur, M1 is GQ subtype. The only exception is heart. In heart it is GI subtype. देखो, now let me tell you about the bronchi. Suppose this is the nerve, this is the bronchi. Bronchi, there is M3 receptor. M3 is GQ subtype. Acetylcholine is released. This acetylcholine binds to M3 receptor. Calcium increases, and that produces bronchoconstriction. Now, whenever the pre-synaptic receptor, I talk about pre-synaptic, here the pre-synaptic is M2 GI subtype. Pre-synaptic is M2 GI subtype, and everywhere I told you M2 is GI except heart, because in heart post-synaptic is this thing. Now, if I talk about Ipratropium, it is an M3 blocker. It is an M3 blocker, and that is the reason why it produces bronchodilation. तो जब भी COPD के पेशेंट में आप इप्राट्रोपियम देंगे वो ब्रोंकोडाइलेटेशन करेगा. किसके लिए? बिकॉज ऑफ M3 ब्लॉक. So whenever I use ipratropium, it will block M3 receptors, and because of that, there would be bronchodilation. Right? And that is why I use it in COPD. But ipratropium, if it blocks M2, it can stimulate release of acetylcholine, and that can precipitate bronchoconstriction, which is paradoxical. So this is an MCQ which was asked. This is an MCQ that was asked in INI set, but the MCQ was different. So paradoxical bronchoconstriction here. See, paradoxical bronchoconstriction. This is the MCQ. The answer is M2. The answer is M2. The answer is not M3, guys. Answer is M2 here. Paradoxical bronchoconstriction due to ipratropium is seen due to block of M2 receptor. So guys, did you understand this? If you have understood, give me a thumbs up. समझ में आ गया आपको? Paradoxical. See, today my aim was to explain to you what is paradoxical bradycardia with atropine and what is paradoxical bronchoconstriction with ipratropium. समझ में आ गया ये? Paradoxical bradycardia and paradoxical bronchoconstriction. Excellent, guys. Excellent. So my aim was to explain, because ये थोड़े से confusing होते हैं. Now I'll discuss some कुछ clinical questions देखते हैं. Let us discuss some. See, long acting beta 2 agonist अगर यूज करेंगे इप्राट्रोपियम के साथ तो क्या होगा? See, long acting beta 2 agonist with ipratropium, if you use it, then it is not feasible. The reason being, ipratropium is very short acting. Right? All right. Sir, clonidine associated with Tourette syndrome. See, clonidine is not associated with Tourette syndrome. Clonidine can be used for treatment of Tourette syndrome, but currently the drug of choice for Tourette syndrome has been changed. I'll discuss in a short while. All right, a farmer who was debt burdened consumed pesticides, organophosphorus for suicidal attempt. He was brought to emergency with symptoms suggestive of acetylcholine surge, which stimulates muscarinic and nicotinic receptor. Which of the following symptoms in the patient represents activation of nicotinic receptors? Diarrhea and salivation, meiosis and fasciculations, dysphagia and diplopia, fasciculations and tremor. व्हाट इज टॉरेट सिंड्रोम? देखो, टॉरेट सिंड्रोम मैं नहीं पढ़ा सकता भाई. टॉरेट सिंड्रोम में टिक्स होते हैं. देखो, आपको पीडियाट्रिक्स या मेडिसिन वालों से पढ़ना पड़ेगा. टॉरेट सिंड्रोम इज अ डिसऑर्डर वेयर द पेशेंट हैज टिक्स एंड देयर आर मल्टीपल टाइप ऑफ टिक्स. देयर इज मोटर टिक्स. पेशेंट इस तरह से कुछ मोटर मूवमेंट करता रहेगा. देयर आर वोकल टिक्स, आवाज करेगा, राइट? और व्हाट आर वोकल टिक्स? टॉरेट सिंड्रोम, देयर इज अ मूवी कॉल्ड एज रानी मुखर्जी इज द हीरोइन, राइट? Hitchki is a movie on Tourette syndrome. You can watch that. Right? Right. Excellent, guys. Excellent. 100% correct answers. You have stumped me. Right? आज तो मछलियों ने मछुआरे को पकड़ लिया है. So D is the right answer. Fasciculations and tremor is the right answer. ABC, diarrhea, salivation, meiosis is there. Dysphagia, these are because of M3 receptor. तो आपको पता है कि यहाँ पे muscarinic play is there. Fasciculations or muscle contraction, tremor, muscle contraction is because of NM receptor and is because of nicotinic. So excellent, guys. Most of you have given the right answer, and I'm proud of all of you. Which of the following will be seen due to activation of post-synaptic alpha-2 receptors by epinephrine? Decreased norepinephrine release, decreased secretion of insulin, glycogenolysis and gluconeogenesis, tremor. So this is an MCQ based upon receptors. So what is the answer? Come on, what is the answer? A, B, C or D? अभी का जो मौसम है ना, अभी का जो मौसम है बड़ा अजीब है। अगर एसी कूल कर दो तो ठंड लगती है, बंद कर दो तो गर्मी लगती है कि नहीं? बड़ा ही अजीब मौसम है। सी डायप्लोपिया See, diplopia can be seen because of nicotinic receptors, because of contraction of the muscles, but uh, the other one in the option, it is not seen because of. So what is the answer, guys? Decreased norepinephrine release. See, decreased norepinephrine release is not the answer because see, what is post synaptic? देखो, आप ध्यान से क्वेश्चन पढ़ा करो। पोस्ट साइनेप्टिक norepinephrine release is because of pre-synaptic and not post-synaptic. This is the right answer. Decreased secretion of insulin is because of post-synaptic alpha 2. Glycogenolysis, gluconeogenesis is because of beta 2. Tremor is because of beta 2. So answer is B. Answer is B. ये आसान क्वेश्चन है. This comes under easy question. It's not a difficult one, right? Rate limiting enzyme for dopamine synthesis. Rate limiting enzyme for dopamine synthesis: dopa decarboxylase, dopamine beta hydroxylase, tyrosine hydroxylase, dopamine esterase. Rate limiting enzyme for dopamine synthesis मतलब, चलो कम ऑन चलो आंसर करो, जो भी करना है करो, आंसर करो। भाई मतलब आई कैनॉट अंडरस्टैंड डोपामाइन है इसीलिए सब डोपामाइन के ऊपर कूद गए क्या? भाई डोपामाइन एंड नॉर एपिनेफ्रिन सिंथेसिस pathway is same. Dopamine norepinephrine pathway is same. At last I convert norepinephrine from dopamine, and for both the rate limiting enzyme is same. अब यहीं पे अगर मैं आपको नॉर एपिनेफ्रिन देता, if I would have given norepinephrine here, all of you would have marked the answer as tyrosine hydroxylase. बट थोड़ा सा चेंज किया तो घबरा गए। ऐसा क्यों भाई? ऐसा क्यों? वाई? क्या चेंज हो गया भाई? नॉर एपिनेफ्रिन से डोपामाइन लिख दिया मैंने तो क्या बदल गया? क्यों आंसर बदल दिया आपने? राइट? सो दैट इज द रीजन व्हाई आई टेल यू, सो यू हैव टू अंडरस्टैंड थिंग्स। इज अ सेम पाथवे ऑफ सिंथेसिस ऑफ डोपामाइन नॉरएपिनेफ्रिन। तो क्या बदल गया? कुछ नहीं बदला। रेट लिमिटिंग एंजाइम इज सेम एंड दैट इज टायरोसिन हाइड्रोक्सिलेज। जस्ट बिकॉज डोपामाइन दे दिया मैंने तो आप घूम गए, राइट? डोंट डू दैट गाइस, डोंट डू दैट। सो टायरोसिन हाइड्रोक्सिलेज इज द आंसर, इज एज सिंपल एज दैट। आई नो, अगर मैंने यही नॉरएपिनेफ्रिन दिया होता आप सब ने राइट आंसर किया होता, ऑल ऑफ इट हैव राइट मार्क द राइट आंसर if I would have given, you know, norepinephrine. Anyways, let's move on to another clinical question. A 45-year-old female who works as a daily laborer was admitted to the COVID ward with high-grade fever and persistent cough. She was started on steroids, remdesivir injection, paracetamol. Routine examination, it was found that she has severe anemia, 5 grams. She was started on blood transfusion, and after which she developed itching, nausea, difficulty breathing. Intramuscular injection of epinephrine was given and she improved. Receptor which is responsible for her improvement is, so देखो, is it alpha 1 induced vasoconstriction, alpha 2 induced prevention of mast cell degranulation, beta 1 induced increased cardiac contraction, beta 2 induced prevention of mast cell degranulation? What is the answer, guys? Is it A, B, C, or D? Now see, what has happened here? What has happened here? So I'll be using English. Don't worry, guys. See, for the important things, I'll be using English. Don't worry. Here and there, little bit of Hindi. So what is the diagnosis? Anaphylaxis. And here, because it is anaphylaxis, there are two possible answers. So let me give you two possible answers. It's a difficult question. Two possible answers are this. Alpha 1 induced vasoconstriction, beta 2 induced prevention of mast cell degranulation. दो possible answer है. But you know that the answer is not only based upon the options, it is also based upon the question. Now look at the question and try to find out, is the answer A or is the answer D? In this question, there are two possible answers, A or D, because it is anaphylaxis. And in anaphylaxis, there is vasodilatation and bronchoconstriction. And there is bronchoconstriction. Right? So answer is either B or D. A or D. Answer is either A or D. So I told you earlier here is to choose between A and D, you have to go back to the answer. You have to go back to the, you have to go back to the question. What do you think? Take some time, you can answer. What is the answer? See guys, here A is not the right answer. The right answer is D. The reason being here, primarily you can see here, they're not mentioning about blood pressure or hypotension. Mostly they're mentioning about difficulty breathing. So based upon that, I'll go for beta 2 induced prevention of mast cell degranulation. So beta 2 receptors are present on the mast cells. And when beta 2 receptors are stimulated, they increase cyclic AMP, which further increases calcium. And that calcium is responsible for mast cell degranulation. That is the reason why mast cell stabilizers are used, which block calcium channels on the mast cells. So here better answer is option D, guys. Better answer is option D. So it's a difficult one. So nothing to worry. It's a difficult one. If you're not able to solve, देखो, no matter how much you study, no matter how much you know, you cannot solve all questions in the exam. You cannot solve all questions in the Q bank. You cannot solve all questions in the grand test. And it is okay. It is fine. Right? But the number of questions that will do right, that will attempt and will get the right answer, it should gradually improve with revisions. So even if you're not able to do a lot of answers right in the grand test, don't worry, don't bother. The exam is on 5th of March. So you guys have got some breathing space, specifically who have started late. Drug of choice for tics associated with Tourette syndrome. Drug of choice for tics associated with Tourette syndrome. Is it clonidine, risperidone, valproate, or tetrabenazine? Drug of choice for tics associated with Tourette syndrome. Clonidine, risperidone, valproate, tetrabenazine. Now this is something I had updated. This is something I had updated. So if you have gone through my update, you'll get the answer right. Most of you have gone through that, I think. And here the answer is tetrabenazine. The only reason I've included this MCQ is why I've included this MCQ is because so that those who don't know the update, they can know the update. Earlier, clonidine was a drug of choice. That is not the drug of choice. Now the drug of choice is tetrabenazine. Tetrabenazine is a drug of choice for tics associated with Tourette syndrome. Tics associated with Tourette syndrome, the drug of choice is tetrabenazine. That's my only aim was to do this, right? Drug of choice for cocaine dependencies. What is the drug of choice for it's an easy question, guys. It's not a difficult question, because see, देखो, in your exam you'll have at least 5 to 6 questions from the drug of choice part, direct. Drug of choice for cocaine dependencies: methadone, desipramine, bromocriptine, ammonium chloride. What is the drug of choice for cocaine dependence? Come on, guys. Methadone, desipramine, bromocriptine, ammonium chloride. Now, to my surprise, I posted this question on Instagram. Instagram में post किया था मैंने, and 90% gave the wrong answer. What's the answer, guys? Come on. Drug of choice for cocaine dependencies: is it methadone, desipramine, bromocriptine, or ammonium chloride? Methadone, desipramine, bromocriptine, ammonium chloride. Come on, guys. Come on. Answer. So please repeat previous. Previous में क्या repeat करना है? Drug of choice for tics associated with Tourette syndrome, it has changed. पहले क्लोनिडीन था. Initially mild to moderate के लिए हम देते थे. Clonidine usually was the drug of choice. Now for any type of tics with Tourette syndrome, I directly go for tetrabenazine. Drug of choice for cocaine dependence. See guys, methadone is not the drug of choice for cocaine dependence. Instagram में जो क्वेश्चन मैंने पोस्ट किया था, पोल में 70% लोगों ने मिथाडोन आंसर दिया था. भाई मिथाडोन इज यूज इन ओपियोइड, और ओपियोइड एंड कोकेन, these are different. Opioid is not equal to cocaine. Opioid is different, cocaine is different. Desipramine can be used, but desipramine is not the drug of choice. Ammonium chloride, it can be used in methamphetamine toxicity, not for dependence. Methamphetamine toxicity. Your answer is bromocriptine. Here, your answer is bromocriptine. See, Morris Columbus, I said if mild clonidine, if severe atypical antipsychotic, that was in previous edition 5. If you go to the Marolin's group, and there is an update post, I have an update post, Pharma Updates 2022. I posted in those updates in the comments, I posted all the changes in drug of choice. And I posted one of the change in drug of choice, and it has been updated. So answer is C, guys, bromocriptine. Answer is C, bromocriptine. See, many people, they have given the answer as methadone. Methadone can never be the answer. Answer is bromocriptine. So guys, cocaine dependence, drug of choice is bromocriptine. Methadone, it is used in opioid dependence. Ammonium chloride, it is used in amphetamine or methamphetamine toxicity. I can use it. All right, excellent. Which of the following drug does not act on SA node? It's a simple question. If you don't know, then it might be difficult. There was a question. When one question is difficult or easy if you don't know the answer. Morris Columbus, I said it last year. In pharma, things change every day, every hour. It has changed this year. This year, the drug of choice is tetrabenazine. It has changed. Adya, Aneshwa, mild to moderate, we can use clonidine, but clonidine nowadays is not preferred even for mild to moderate. We will go for tetrabenazine, mild, moderate, severe, चाहे कुछ भी हो. I'll go for tetrabenazine. Morris Columbus, that is what I've said. I've told twice already that that was last year, 2021. Mild clonidine, severe atypical antipsychotic was last year. This year it has changed. Guidelines have been updated. Now the drug of choice is tetrabenazine. Right. So which of the following drug does not act upon SA node? Epinephrine, norepinephrine, isoprenaline, dobutamine. Come on guys, what is the answer? Which of the following drug does not act upon SA node? Half engineer, if you're not using Insta, not an issue. It is not an issue. I'll tell my Insta ID. At last, I'll tell you the Insta ID. So what is the answer, guys? Which of the following drug does not act upon SA node? Epinephrine, norepinephrine, isoprenaline, dobutamine. Surprisingly, now most of you are going for answer as isoprenaline. Isoprenaline, say isoprenaline stimulates beta 1 and beta 2. Right, beta 1 and beta 2. And out of all the drugs we have, maximum increase in heart rate is caused by isoprenaline. And one is because of direct action of beta 1 on the SA node, and because of reflex effect due to vasodilation on beta 2 receptors, right? Epinephrine increases heart rate. Norepinephrine decreases heart rate, right? Dobutamine, it stimulates beta 1 on myocardium, but not on SA node. So see, dobutamine increases contraction, but dobutamine maintains a normal heart rate. All these three drugs, they will also increase contraction. So they go contraction, that means all of them, they act upon myocardium, right? Epinephrine heart rate increases, norepinephrine decreases, isoprenaline maximum or significant. Dobutamine increases contraction but maintains a normal heart rate. And that is the reason why it is the inotrope of choice in acute CHF or acute congestive heart failure. The reason being it does not increase the oxygen demand. So dobutamine क्या करता है? What it does not increase the oxygen demand because of maintaining a normal heart rate. There is a reason why it is preferred in acute CHF. So देखो ये पढ़ा है मैंने आपको. I've taught you this. So at least ये तो आंसर आपको सही करना चाहिए. Dobutamine is not that a difficult one. A 52-year-old male was brought to the emergency after road traffic accident. His blood pressure was 80/60. Heart rate was 55. On further examination, it is found out that he had lost sensation and reflexes below thoracic level. Which of the following drug would be most appropriate for this patient? Dopamine, epinephrine, norepinephrine, vasopressin. Dopamine, epinephrine, norepinephrine, and vasopressin. So I've given you another clinical question here. So what is the diagnosis, guys? Atom, yes, you can listen to previous Pharmcasts. So what is the diagnosis, guys? First of all, see, road traffic accident, he has lost sensation and reflexes below the thoracic level. He has lost sensation, reflexes below thoracic level. Sensation, reflexes are lost below the thoracic level. That means it's obvious there is a spinal cord trauma, right? And it is at the thoracic level. And thoracic level is the sympathetic division. That means this is spinal cord trauma. And blood pressure decreases is because of I can say it is neurogenic shock, right? So obviously I'm going to use a vasoconstriction. I'm going to use a vasoconstrictor. And what is the vasoconstrictor I'll prefer? So I've just simplified the diagnosis for you guys. What am I going to use? Dopamine, epinephrine, norepinephrine, vasopressin. आप तो डायरेक्ट vasopressin पे ही टूट पड़े. आपको ऑप्शन दिया गया कि बंदूक से मारें या तोप से मारें, आपने सीधा तोप चला दिया, बंदूक की जरूरत ही नहीं है. See, remember here, the vasoconstriction that is preferred is norepinephrine. If there is no response to norepinephrine, then I go for vasopressin. So remember, vasopressin, it is, see what is the use of vasopressin? Vasopressin, it is used in norepinephrine resistant shock. Remember, vasopressin is not my first go-to drug in shock. My first go-to drug where I want severe vasoconstriction, like in septic shock, neurogenic shock, cardiogenic shock, I go for norepinephrine. If 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 norepinephrine is not effective, then I go for vasopressin. Then I go for vasopressin, right? Alpha 2 agonist approved only for opioid dependence is alpha 2 agonist that is approved only for opioid dependence. Tizanidine, clonidine, dexmedetomidine, lofexidine. I've taught you this. The only thing is that if you remember, you can answer. So these questions are quite difficult. Quite difficult if you don't know the information. Aman Vareshi, see, clonidine in Tourette syndrome, I might have taught that in edition 6, but once it has changed, I posted an update also in Merrill-Link's group. In the Merrill-Link's group, there is an update. There is one post. Just search pharma updates in Merrill-Link group. And not only this, there are other updates also that I have posted. There are a few other changes in drug of choice I posted there. So update according to that. Because I record on a particular date. So I've recorded the Merrill lectures I recorded in Feb, I think. In Feb, I recorded. Then it was changed in March towards March last or April, it has changed. Right. So alpha 2 agonist approved only for opioid dependence, guys. What is the answer? Tizanidine, clonidine, dexmedetomidine, and lofexidine. Come on, guys. What is the answer? Alpha 2 agonist approved. See here, the answer lies in this word only. So tizanidine, it is approved, is only alpha 2 agonist used as muscle relaxant. See, clonidine has many uses. Many uses, including opioid dependence. So it is not only, that is the reason why it is not the answer. It is muscle relaxant, it is not the answer. Dexmedetomidine is used only in anesthesia for pre-medication, right? So answer, the remaining answer is lofexidine, guys. The remaining answer is lofexidine. Lofexidine is an alpha 2 agonist that is approved only for opioid dependence. In a NEETPG few years back, they had asked you which alpha 2 agonist is only used as muscle relaxant. Your answer was tizanidine. They can ask you which alpha 2 agonist is only used in anesthesia. Your answer would be dexmedetomidine. Right. So this is the right answer. Next one, guys. Clonidine, cause of clonidine withdrawal hypertension. Cause of clonidine withdrawal hypertension: alpha 1 upregulation, alpha 2 downregulation, alpha 2 upregulation, alpha 2 downregulation. What is the cause of clonidine withdrawal hypertension? What is the cause of clonidine withdrawal hypertension? Alpha 1 upregulation, alpha 1 downregulation, alpha 2 upregulation, alpha 2 downregulation. देखो, I'll tell you, come on, comment the answer. I'll tell you the basic thing of upregulation, downregulation. See, whenever there is a receptor, if that receptor is stimulated too much or for a longer period of time, then it leads to downregulation. Downregulation means there is a decreased number of receptors. When a receptor is blocked too much or for a longer period of time, then that causes, so this causes, right? This causes receptor upregulation. This causes receptor upregulation. Upregulation means there is an increased number of receptor. Remember this basic thing. जब भी आप किसी रिसेप्टर को जरूरत से ज्यादा स्टिमुलेट करेंगे तो जो रिसेप्टर की संख्या है वो कम हो जाएगी, उसे हम कहेंगे डाउन रेगुलेशन. जब भी किसी रिसेप्टर को जरूरत से ज्यादा आप ब्लॉक करेंगे तो रिसेप्टर्स की संख्या बढ़ जाएगी, उसे हम कहते हैं अप रेगुलेशन. सो अंडरस्टूड दिस. व्हेनेवर, नाउ इन इंग्लिश, whenever I stimulate a receptor more than required, then the number of receptors decrease. It is called as down regulation. If I block a receptor more than required for too long, then the number of receptors, it will increase, and that is called as up regulation. So if you know this, you know the answer. What is the answer? Is it A, B, C, or D? What is, now see, what is clonidine? Clonidine is alpha 2 agonist. Clonidine is alpha 2 agonist. From this, try to give me the answer. इसमें से आंसर निकालने की कोशिश करो. This has been asked in one of your exams. So if it is alpha 2 agonist, can there be alpha 1 up regulation, down regulation? No. Because of alpha 1 agonism, what's going to happen? Decreased number of alpha 2, or there would be alpha 2 down regulation. Answer is alpha 2 down regulation, guys. Alpha 2 down regulation. See, I've just given you a simple logic. Whenever they ask you about up regulation, down regulation. For example, antipsychotics, which are D2 blockers, they cause tardive dyskinesia. And this is because of D2 up regulation. So this we'll discuss in CNS. I'm just telling you here, because there is block for very long, tardive dyskinesia. You know, tardive dyskinesia, it takes many months to years. So D2 up regulation, number of D2 increases. So this is, phentolamine reverses this condition. See, it's a complicated thing. How phentolamine reverses this? See, at the end of the day, in a synapse, norepinephrine is released, and this norepinephrine is gonna stimulate alpha 1 and produce vasoconstriction, right? And if you want to explain that phentolamine, it will take a long time. So I just wanted to avoid that. But anyways, see, this is alpha 2. These are alpha 2. So I have an army of alpha 2 here. Now what happens if I give alpha 2 agonist, that is clonidine? If I give clonidine will stimulate these receptors. Alpha 2 receptors. And what is the function of alpha 2 receptors? Usually, the normal function of alpha 2, it is to block release of norepinephrine, isn't it? Now what happens after some time? There would be alpha 2 down regulation. And alpha 2 down regulation means what? It means many of these receptors are not there to control the release of norepinephrine. So suppose all these receptors are gone and now there is only one receptor. Now when norepinephrine is released, try to understand this. Norepinephrine is released, it would stimulate alpha 2 and alpha 2 will block release of norepinephrine. But for that, I need good number of alpha 2, which is not there, because of alpha 2 down regulation. So there would be a significant surge of norepinephrine release, and this norepinephrine would stimulate alpha 1 and will cause vasoconstriction. So what do I use for treatment? I block alpha 1 by giving a drug called as phentolamine. So at the end of the day, hypertension is seen because of alpha 1, right? Right. A 25-year-old delusional patient who was throwing stones at people who was seen shouting, "Go Corona, go." He was apprehended by police and taken to RML hospital. It was found out that he is a drug abuser. His blood pressure was 220 by 120, heart rate was 160. He was started on diazepam, to which he calmed down, but blood pressure was still high. Which of the following drugs should be given in this patient? So there is a drug abuser, and that drug abuser is having high blood pressure, right? And for that he was given diazepam for his abnormal status, and blood pressure is still high. What should I give? What should I give? A, B, C, or D? What do you think, guys? What do you think? So he's a drug abuser. He's a drug abuser, and in a drug abuser, there is an increase in blood pressure. This might be because of cocaine. It might be because of meth, amphetamine-like drugs. And they increase blood pressure because of increase in release of norepinephrine. And this norepinephrine will not only stimulate alpha 1, it will also stimulate beta 1. It will also stimulate beta 1. It will also stimulate beta 1. That means in this patient of drug abuse, there is a risk of hypertensive emergency. Blood pressure is already high. Plus there is a risk of arrhythmia as well. So I need to block alpha 1 and beta 1. For that, I'll be using IV drugs which are short acting because it is emergency. You got the clue now. Now what is the answer? A, B, C, or D? Excellent, guys. Most of you have started giving the right answer. Phentolamine, esmolol. You got the point? So here is because of catecholamines, norepinephrine. That is the reason why BP is high. Most selective alpha blocker. Which is the most selective alpha blocker, guys? Phenoxybenzamine, prazosin, tamsulosin, silodosin. A, B, C, or D? Phenoxybenzamine, prazosin, tamsulosin, silodosin. See, most selective alpha blocker, here the better answer is silodosin because it is alpha 1A blocker. Tamsulosin is alpha 1A blocker and it has little bit effect upon alpha 1D as well. So see, usually we calculate both as alpha 1A blocker, but little bit of alpha 1D block is seen in tamsulosin. There is a reason why. Remember, if they ask you most selective alpha blocker, your answer will always be silodosin. Most selective alpha blocker, silodosin. It is not tamsulosin. And selectivity is never absolute. Most selective beta blocker: nadolol, esmolol, nebivolol, bisoprolol. Which is the most selective beta blocker? Come on, guys. Most selective beta blocker. A, B, C, or D? Which is the most selective beta blocker? See, guys, most selective beta blocker, it has been asked in our exams earlier. Pehle पूछा जा चुका है. It has been asked. Most selective beta blocker, it is nebivolol. Most selective beta blocker, nebivolol. Second most selective is bisoprolol. So if nebivolol is not in the option, then go for bisoprolol. It is not nadolol, it is not esmolol. Nadolol, so answer here is nebivolol. Nadolol, remember, nadolol is the longest acting beta blocker. Esmolol is the shortest acting beta blocker because it is metabolized by plasma esterase or pseudocholinesterase. Nebivolol is most selective, bisoprolol is second most selective. Alright, guys, so we're done with the questions. If you have any doubts, you can ask me. Any doubts, most welcome. And we'll wrap up this session because it's already midnight. और इतनी रात को दुनिया में हम ही लोग हैं जो पढ़ाई करते हैं यूजुअली. I guess if you have any doubts, do let me know, guys. Otherwise, see why V-LABA is not used in bronchial asthma. Travel Foodie is asking why V-LABA is not used in bronchial asthma. See, it's not that V-LABA cannot be used, but V-LABA is not approved for asthma because the company which makes V-LABA has not made it for asthma. I mean to say, they have not applied with the FDA for approval of asthma. Now, why they have not done that, I don't know. I mean, practically, logically, it can be used in asthma, but it is not approved for asthma. See, norepinephrine will cause reflex bradycardia and neurogenic shock, but at that time, I want to save his life. I want to save his life because of vasoconstriction. But yes, the point is correct. Because of bradycardia, in case of neurogenic shock, it can cause bradycardia. For that, we also give atropine. Atropine is also given. See, cholinergic and myasthenic crisis. I've explained this in the lecture. Cholinergic crisis, myasthenic crisis. Cholinergic crisis, it is due to excess of acetylcholine. Myasthenic crisis, it is due to excess of antibodies, right? These antibodies, they block NM receptors and there is decreased muscle contraction. Myasthenic crisis because of excess of antibody. Cholinergic crisis because of excess of acetylcholine, it would stimulate NM receptor, right? But this stimulation will continue. Too much stimulation will inactivate the sodium channels. So see, too much stimulation, what it does, it inactivates sodium channels. So initially there might be an increased muscle contraction, but inactivation of sodium channel will decrease muscle contraction. So at the end of the day, be it cholinergic crisis or myasthenic crisis, whenever a patient presents to you with severe fatigue, so much so that he cannot breathe, he cannot even stand up or sit, that decreased muscle contraction, it can be due to myasthenic crisis or cholinergic crisis. Now, when I give adrophonium increases acetylcholine, and this increase in acetylcholine will worsen cholinergic crisis, but this increase in acetylcholine will improve this muscle contraction because this acetylcholine will knock off the antibodies. There is a difference. So I've explained that. See, drug of choice updated, I'll post. See, there is bradycardia, but we do, see, I want to save the life of the patient. You saw the blood pressure, it was so low blood pressure. He will die of shock. So, पहले जान बचाना है, but we use atropine as well. We'll use atropine. Guaifenesin is used in treatment of tics. See, it is not guaifenesin, it is guanfacin. Guanfacin is used in tics. देवदीप फिनॉक्सीबेंजामिन प्लस एस्मोलॉल इसलिए नहीं होगा बिकॉज फिनॉक्सीबेंजामिन इज एन ओरल ड्रग. एमरजेंसी है, आई नीड टू गिव IV ड्रग, दैट इज व्हाई आई गिव फेंटोलामाइन. See, all the updates in drug of choice. Okay, guys, I'll try to make an updated DOC. See, Kadzang, which controversial statement? Because see, different textbooks, they differ from different things. NEETPG 2023 date is there. Aim is FMG 2023 will also be there. See, God only knows. Only NMC knows. Sarthika saying difference between urge, stress, overflow, incontinence. I've explained this in my Mero videos. Though see, it is not my domain, but I still explain incontinence in Mero videos is because uh, otherwise you'll not be able to understand the treatment. And it will take half an hour. It will take half an hour for me to explain the three different types of incontinence. Uh, Next session topic, I've already told you in the beginning, guys. Next session topic, I told you in the beginning itself. Next session topic is this: CVS, cardiovascular system. Cardiovascular system. You can take the picture. You can take the picture, take the screenshot. I'll post it in Instagram, Facebook, everywhere. Drug of choice for hypotension in spinal anesthesia is phenylephrine, guys. Hypotension, spinal anesthesia, phenylephrine. Doctor, I am someone. Thank you very much. See, Maurice Columbus, alpha blocker followed by beta blocker in pheochromocytoma is because if I block beta first, I'll block beta 2 mediated vasodilatation. And because of only alpha effect, blood pressure will significantly rise. Yeah, the patient will die. Uh, See, I'll post an updated Farmcast videos, guys. So thanks a lot for joining in today's session, and I hope these sessions are benefiting you. Plus, I told you more than this session, what's important is from what you do from Monday to Saturday. Monday to Saturday, you have a lot of time at your hands now, and in between these times, you might feel sometimes depressed. You're not achieving your target, right? It happens every day. You'll not have the same yield, but believe me, if you keep slogging right towards the end when you start revision, right, everything will fall in its place. But now you have to keep the faith, believe in yourself, and keep marching forward. In the next week, let's pledge to cover cardiovascular system by this way. Please do this. Revise for 15 minutes, then re-revise for 5 minutes. Please do that. Let's pledge that will kill cardiovascular system in the next week, and so on gradually, week by week, by giving little bit of time every day. I'll be able to master pharma, guys. So that's all from my side, guys. Thanks a lot for joining. Take care. Bye bye. This was Dr. Ranjan with you.